Hello, I'm Greg, the Respiratory physio, and today I'm going to talk to you about a condition called bronchiectasis. Bronchiectasis is a chronic respiratory condition where your lungs suffer from recurrent chest infections. Your airways produce more secretions than normal, and the airways around them can become inflamed and then floppy, and that gives difficulty in clearing areas of secretions. These secretions then, because they are stuck and you can't ventilate around them, are a breeding ground for further infections, and this can lead to the condition worsening. Now, in response to this, your GP or your consultant may have referred you to a respiratory physiotherapy for chest clearance techniques. One of my other videos is something called the active cycle of breathing technique, and that's sort of a basic series of breathing exercises that can help clear sputum. And the reason it's important to clear your sputum is that you don't want that lingering and allowing germs to harbour and further infect your lung. Other advice that we would give you from an outpatient perspective would be to stay active. It keeps you in good physical and mental health. It also encourages you to ventilate with larger tidal volumes, so you take bigger breaths when you're walking or enjoying activity. And that is essential for helping keep your lungs clear of secretions and help you encourage and increase the strength of your cough so that you can clear easier. The other thing we would recommend that you do is to keep yourself well hydrated. An easy way to do this is to drink plenty of water or squash. We would advise you to not necessarily stay away from, but certainly limit the amount of caffeine drinks, so tea and coffee or alcoholic beverages, as these both cause the body to pass more urine than the fluid content involved, so you actually dehydrate yourself. Having good hydration levels will allow you to lubricate the secretions, and it'll thin it out, so it makes it easier to cough up. And the other thing that we would suggest is, if you've been prescribed any inhalers or nebulizers, to use those routinely prior to any respiratory physio techniques that you may be asked to do, because it will help open up your airways or loosen secretions further. If you haven't been prescribed those things, then things like, as I mentioned, exercise, or even simply having a shower and being in a steamy environment may be enough just to sort of tip the tide in your favour and help clear those secretions. I'm going to talk briefly about a couple of devices that may further help you in a subsequent video.